Now to a health alert we've been following. We're hearing more about an emerging fungus that's becoming a serious global health threat. That's according to the CDC. They've seen the number of what's called Candida auris rising over the last few years, and they want the public now to be aware. Take a look here at the number here in the United States from just last year. Florida, in fact, is now ranked number 3 in the country with the most cases. If it'll come up, it'll show you 349 cases there. When we tap on California, you see there 359 cases, and Nevada, which is right above it, 384 cases. ABC Action News reporter Rebecca Petit speaks with doctors tonight on why the fungus is hard to kill and who is most at risk.
Cases of the dangerous fungus now rising at an alarming rate, with more than half of the states in the country reporting. Florida seeing some of the highest number of cases.
Pastor Tom Johnson often visits parishioners who are hospitalized and has seen what healthcare-associated infections can do.
A number have gotten something from a hospital, so it's really not a pleasant thing to hear about.
Today, Johnson is visiting his wife at Lakeland Regional Health. He's worried after hearing about a fungus rapidly spreading in hospitals across the country.
Scary. We got things like, MRSA in hospitals, so having something like this is just awful.
The fungus is called Candida auris. It's a form of yeast that is usually not harmful to healthy people, but can be deadly to people with weakened immune systems. The CDC has called the fungus an urgent threat because it's often multi-drug resistant, easily spreads through healthcare facilities, and can cause deadly disease.
In hospitals, Candida yeast infections are more commonly seen because also one of the things that facilitates it in people is when people have taken lots of antibiotics. And so they have lowered the good bacteria that we have on our skin or in our intestines, and then things have the opportunity to grow, like Candida.
The number of people infected by Candida auris has tripled in the U.S. in the last 3 years, according to a new study by the CDC. Florida saw 349 clinical cases in 2022. Doctors say properly identifying the fungus is critical so that medical personnel can go the extra mile to treat it.
If a person is suspected of having a bacterial infection and they're put on antibiotics and a couple of days later they're not getting better, there should, especially in a hospital setting, be a high level of suspicion that this is what's going on.
Dr. David Berger tells me being vigilant will mitigate the spread in medical facilities.
It's certainly up to our healthcare establishment to do the right thing. Right. But it's perfectly fine for a patient if they see somebody walking in and doesn't wash their hands or is sharing something from one to the other. Speak up for yourself. Let it be known, hey, are you using the proper precautions to prevent me from catching Candida auris?
The CDC says pandemic-related strain on healthcare systems likely drove the increase. Rebecca Petit, ABC Action News.